this may be a little clearer with the arrow rather than that little red dot. We put this laser flow probe on the surface of the skin. It shines a light into the across the skin, reflects off of these blood vessels, and gives us an indication of how much blood flow is occurring underneath the laser rather. In addition, we use a technique called microdialysis, cutaneous microdialysis, where we actually insert a tiny little tube under the skin. I'm sorry, I referred to this as the blood vessel before. These are the blood vessels that we're measuring. Rather, we insert this microdialysis catheter under the skin, and the microdialysis catheter has very tiny pores, and it allows us to inject drugs under the skin with which we can artificially control the blood flow, as well as being able to infuse drug. These tiny little holes allow us to collect fluid, which we then use, we call it the recovered dialysate, for subsequent chemical analyses, some of which I'll show you later on. This is a little depict how we do it. We employ sterile techniques. Once again, this is all approved by the Medical College IRB, and although it looked uncomfortable, in fact it's not. Having had it done many times myself, I can attest to that. What we do is we numb the area of the skin with ice. We take a very, very fine 25 gauge needle, and we insert the needle under the skin, and then we insert this tiny little thread, the catheter, through the opening of that very, very small needle. So that'll give you some idea as to how fine this catheter or tube is. In fact, it's just slightly larger than the thickness of a human hair. We then pull it back so that the permeable, semi-permeable microdialysis portion is sitting under the skin. This is what the laser looks like, and then when we assemble the whole thing, this is actually the laser. This larger collar is the heating element, and as I mentioned earlier, we can heat the area under the skin. And this is actually one of my favorite slides. It really is quite relaxing, because once you get over the minor discomfort of having those microdialysis tubes inserted under the skin, you can spend the afternoon reading, sleeping, watching television, or as many of our younger subjects do, texting. This is a skin response to heat. This is how much blood is flowing through the skin at rest, and as many of you know, when you get hot, your skin sweats. Your body cools itself by diverting blood to the surface of the skin so that it can be exposed to the cooling air, and this is a demonstration of how that works in part. We impose heat. Over here it says heat start, and you can see that there's a characteristic increase of the skin blood flow from these about 20 arbitrary units to about 150, 160. The exact measurement is relatively unimportant. Suffice it to say that there is this characteristic first peak and then the plateau, and we compare the response from controls to those subjects with chronic fatigue and those with POTS, and we're actually doing some very interesting studies now where we use different drugs, which I'll talk about in a second. This is a little slide that shows that the skin is in fact responsive to those chemicals and drugs that we can insert or introduce under the skin. This is acetylcholine in increasing concentrations, and you see a dose-dependent increase in the skin blood flow. It shows, therefore, that this technique allows us to use pharmaceutical agents. This is a very interesting slide, at least from my perspective, that is showing the skin response to heat for control, shown in the white. And notice that the response to heat in subjects with POTS is reduced. Now, remember before I talked about nitric oxide, which helps to dilate blood vessels. we and others have shown convincing evidence that, in fact, nitric oxide is responsible for this increased blood flow, because if we introduce a substance here shown by the letters NLA, which is an inhibitor of the enzyme or chemical that makes nitric oxide, all of a sudden you can take a control subject and revert their response to heat to be similar to subjects with POTS, suggesting that in some POTS patients there is an alteration in the production or presence of nitric oxide, which is one of the factors that controls skin blood flow. In this depiction, we show two things. One is a recording of the heat response by measuring laser blood flow, and we actually, if you remember the slide I showed previously, we actually can collect the effluent or that which comes out of that microdialysis tube, and when we measure it for directly using a microelectrode, a measuring device that's sensitive to nitric oxide, you can see that in concert with the increased blood flow, we show an increase in the presence of nitric oxide that increases along with the introduction of heat, whose production also decreases once the heat is turned off. So these are among the studies that we do in the skin. And I spoke earlier about the fact that we're interested in what may be at hand in terms of some of the neurocognitive defects experienced by subjects who are, as indicated earlier, both either orthostatically challenged or who have chronic fatigue syndrome. And we measure the transcranial Doppler ultrasound. This is a depiction of what's known as the circle of Willis, which is basically a traffic circle at the base of the brain through which blood flows, and then there are branches of arteries and blood vessels which thereafter supply the brain. We use an ultrasound probe which sits on the surface of the skull. This is non-invasive, and which allows us to measure the middle cerebral artery flow characteristics. This is a study subject just showing that this is the ultrasound probe. This is a little headgear that they wear to keep it in place, and we measure brain blood flow. Now, brain blood flow is very, very interesting because brain blood flow exhibits characteristics of autoregulation. And it's a good thing for all of us that our brain blood flow is autoregulated. By that I mean that the constancy of cerebral brain blood flow, that is the blood that supplies our brain, is well maintained over a large range of blood pressures. You can appreciate the fact that if your blood pressure drops, as it does transiently or temporarily when you go from lying down to standing up, if it wasn't regulated, your brain blood flow would drop, and you wouldn't have enough blood to maintain the necessary functions of the brain, in particular consciousness and cognition. The flip side of that is that if your blood pressure goes up, you do not want your brain blood flow to go up in concert with your blood pressure for various reasons, among them the fact that your brain is contained within a fixed volume, and if your brain blood flow goes up too high, it's not good for you. So that's the process of autoregulation, and this confounding slide just depicts, this is from a review by Dr. Ainsley, which was just published, which shows some of the factors which control brain blood flow. Let me point out that, as I mentioned earlier, carbon dioxide is very important, as are other factors. And I'm nearing the end of the talk. I know it's we only have 5 minutes until the hour is up. but if you'll bear with me, I just want to finish telling this story.